Hello and welcome. My name is Rachel Gitner, Planned Giving Officer at Legacy Health. I'm here today with Jonathan Avery, MHSA, President of the Legacy Health Willamette Valley Region. I also have with me Clay Cooper, CFP, trusted friend and advisor, who leads the Cooper Wealth Management Group at Northwestern Mutual. So welcome, gentlemen. Thank you for being here today. I have an icebreaker for you both to start us off. I know this is a hard question, but name one positive outcome of the pandemic, something that you can take with you when this is over on a personal level. Jonathan, how about you?
Well, it's great to be with you all today. Probably the most impactful for me personally is that it's really reinforced for me the importance of community. For everyone that's been working on the front line as responders to the pandemic in healthcare, the level of stress has been truly incredible, and it's really challenged our resilience, challenged our ability to come back every day to do complex, high-risk work. And, the outpouring of support from our local communities has been truly incredible and provided a big morale boost to our teams at many times when they've really needed it. Early in the pandemic, as many of you are likely aware, across the nation, folks started to come out of their houses at 7 p.m. every night to essentially cheer on frontline workers. Since then, we've seen some pretty extravagant displays of the community just really coming together to show their support for us. I think we're up to 3 parades at Meridian Park over the last several months. Usually this has entailed several hundred cars all lined up, driving around the campus, honking their horns, usually led by law enforcement and EMS personnel with lights and sirens flashing, and school kids hanging out of the cars holding up signs thanking nurses and physicians for the incredible work they do. The other thing that continues to just be astounding to me, and this happened again in the wildfires here recently, is that we've had dozens of local restaurants basically show up and bring our staff and physicians lunches and dinners. Probably the biggest thing, maybe the most popular, was over 1,000 cases of wine that were delivered to our caregivers across Legacy. I mean, those kinds of things they just go a huge distance in terms of moral support and recognition to keep us coming back doing what has been stressful hard work every day.
Thank you. And yeah, this is a really great time to thank all of you at home who have shown up in so many ways for us. It's really, as Jonathan said, been a morale booster. So thank you so much. Clay, what about you?
Well, thank you for having me here today, but definitely would echo what Jonathan said around community through all of 2020, not just COVID. It seems like we've been thrown multiple curveballs this year, but my biggest takeaway is that many of the walls that we create in our lives, they're not physical walls, but they're mental ones. And for me, this pandemic has made my professional life very fluid. For me, the value of community and also family. My family's not here in Portland. They're kind of spread out all over the Pacific Northwest. So my wife and I have been able to regionally travel, so get in the car and spend a week or two in Idaho and Washington and California, just working virtually and being with family. So that's been a silver lining in 2020 and a unique experience.
Yes. Yay for prioritizing family during this time. Absolutely. So let's pivot and talk about leadership. Legacy has been a leader in the fight against COVID-19. Jonathan, tell us a little about that.
Many of you may not be aware that Legacy was called on to become a leader in developing capability to respond to infectious disease outbreaks starting several years ago. It actually began with the worldwide Ebola outbreak. When Ebola began to spread across the United States, Legacy was essentially the organization in our region that stepped up to become the only Ebola assessment center in the region. We started this in partnership and with support from OHSU and Kaiser. And what we ultimately did was establish what we call the Biological Isolation and Containment Unit at Legacy Good Samaritan's campus in the Kern Critical Care Unit. This, for short, has become affectionately called the BICU. So to this day, if there is a patient that requires a very high level of isolation in our region, they would be transferred to and cared for in the BICU at Good Sam. Where this, I think, really became important in terms of our preparation for then a worldwide pandemic in the form of COVID-19 is that in order to develop the BICU, we trained a huge team of nurses, physicians, and respiratory therapists to become the BICU team. I think today we're up to probably 75 to 100 members of this team. So when COVID came on the scene, Legacy was able to deploy our BICU team across all of our hospitals to train all of our staff in the appropriate use of PPE. Substantially because of this, to this day, Legacy has an incredibly good employee safety record in caring for COVID positive patients. We've now cared for really hundreds of patients, over thousands of patient days. We have over 14,000 employees who come together to take care of these patients. And we've only had 6 employees in the last 9 months exposed to COVID. This is way, way, way below national exposure rates in other hospitals and health systems. So it's been a huge part of our success in keeping people safe and really taking good care of patients. The other thing that the BICU prepped us for is Legacy had stockpiled a great deal of PPE to help to support the BICU. So when many organizations were going up against potential shortages, we were able to lean back on that stockpile and really make our way through without any critical shortages for our patients. So anyway, we have been a historical leader in taking care of infectious disease patients, and it really did put us in a good place to be effective in taking care of COVID-19 patients.
Thank you, Jonathan. And in that same vein, how has Legacy driven innovation over the past 6 months, especially as it pertains to the impact on our community?
That's a really interesting question. And, one of the more fascinating aspects of COVID has been that it has driven us to really develop innovative ways to take care of patients. Certainly, one of the biggest things with COVID was making sure that we minimize exposures. And what it did for us as a healthcare organization is it drove us to the rapid adoption of virtual video visits. And at our peak, 75% of all of our visits had actually gone to virtual via video platforms. So when we take a look at the go forward, I think us in Legacy, and certainly as you talk to our colleagues across healthcare, nobody thinks we're going back to the old normal. Most people think that we'll probably end up at around 30% of all of our visits on a go forward basis being through these virtual video platforms, which is just a huge change from how we used to deliver care in the past. And when you think about it, there's big implications for those kinds of changes in terms of how we run the healthcare system that we're now starting to wrap our heads around. You need less space, you need less exam rooms, you need less parking, and in some cases, you even need less staff. And so it'll be interesting to see. I think not only is it something that works well for patients, but it's also something that's likely to bring down the cost of care over time as well. The other real innovation that I wanted to touch on briefly is what we refer to as drive-through visits, something that didn't exist at all other than maybe drive-through pharmacies. In order to really get a safe way to bring testing of patients in a critical mass type of way to our patients, we decided that we needed to stand up drive-through testing stations, and it's super efficient for patients. So this is another concept that we believe is here to stay. In the last few months, I've actually had several development and architectural firms reach out to me that are in rapid phase of developing physical plant designs, technology concepts, all to support drive-through visits in the future. So again, I think an innovation that was caused by COVID, but something that will be here to stay and we'll probably see a lot more of in the coming years.
That's really exciting. Exciting times. Thank you, Jonathan. So I'm going to turn to Clay now. Clay, many of our allied professionals like you are business owners and solo practitioners. Talk about some business adaptations that have been innovative and that have contributed to your success over the past several months.
That's a great question, and it's fun to hear Jonathan's reply because there's a lot of parallels there. But I think first and foremost is that the vision of our practice from day one's been co-created with the team. And what I mean by that, it wasn't dictated by me, but the team had come up with it. And when you have a team that's really bought in to the vision and aligned with the goals, that creates an amazing culture where when you're throwing a curveball, everyone wants to rally around it. But when COVID happened and we were forced to work from home, home, it was a pretty seamless transition since we were using things like DocuSign. And about 30 to 40% of our meetings were already being run virtually, obviously with a younger demographic of clients kind of fitting into that 30 to 40%. Now, with that said, almost 100% of our practice is virtual today. And it seems kind of counterintuitive, but we feel like we've been able to develop stronger and deeper relationships with clients. And if I had to hypothesize without having any real data, it's because they're not dealing with traffic, so it's not stressing them out on the way into the meeting. They're not looking for parking in a crowded lot. They're not forgetting what floor to hit on the elevator on the way up, and so they're able to meet with us from the comfort of their home. It makes it less stuffy, and I think because of that experience, they want to meet more frequently with us. And we're able to run more efficiently. So it's a win-win on both sides, meeting with clients more frequently, going deeper into their financial plans, understanding their goals. And I've been joking with the team that if I could see my doctor virtually, I would have probably gone more than twice in the last decade like I have. So it's good to hear that Legacy is adapting to some of those kind of virtual meetings as well. And I really do think it's a way for the future.
Speaking of clients, we all need a little inspiration now and then. Tell us about a client or clients whose strategy has adapted during this time with good results. How do they live and give differently now?
I think the pandemic, it's affected so many different people in different ways. I know they do feel even almost a sense of guilt that they've kept their jobs, their paychecks are still coming in, their investment accounts have recovered, and actually on top of it all, they're just spending less money. They have more money to actually gift this year, and with so much happening in 2020, whether it's been COVID, whether it's been social justice, whether it's been the wildfires as of recently, there's a lot of conversations to go back to clients and ask, what are their values, what's their vision, what are their goals with the money that they have, and they've arisen to many of the challenges that 2020 has presented us. One other change from an adaptation standpoint that didn't get nearly as much attention because it was some legislation that was passed in December 2019, but was the Secure Act. And so when we're talking to clients about gifting and especially around their estate, the Secure Act requires clients to spend down their IRAs, their inherited IRAs over 10 years. So we've looked at, okay, what are the assets in the estate, things like real estate, your stock portfolio, your 401k or IRA, and what do you want to give to that next generation, and what are your desires in terms of nonprofit giving? And to actually bequest a lot of the IRA dollars to nonprofits seems to be the best play from a tax perspective because it gets it out of the taxable estate. It can avoid the income tax that your heirs would have to pay, and then they don't have the dilemma where they have to spend it down over the next 10 years. The real estate and stock portfolios, they get to step up in basis, or even life insurance that pays out tax-free seems to be better tools and strategies to give to that next generation.
Given legislative changes, what is the best, most tax-wise way for most people to give right now? What do you find yourself telling your clients regarding their giving?
When I'm connecting with clients, one thing I am encouraging is that, with your vision and values and goals, ultimately that you gift what you want to, and not let taxes decide how you're going to give the money. Now, with that said, we want to be as efficient and wise as possible as we are gifting those dollars. And so one strategy, if you're not using right now itemized deductions, is the DAF, the Donor Advised Fund. It allows you to put a larger contribution into it multiple times, but in theory, you could do it 1 year, kind of combine all the gifts that you would make in the future, get above the standard deduction, so you can get a deduction on your gifts, and then for the years to come, spend money out of it. It is an irrevocable trust, so it's money that's not yours anymore. It kind of feels like yours because you're going to see the account and you're going to decide how it's spent. but it's not money that you can pull back to yourself. I'm encouraging clients keep giving. You're giving because it's the right thing to do. It feels well, and over time the tax code will continue to change, and maybe we'll get deductions for those small donations again.
That's excellent advice. I guess the real lesson is to go to your financial advisor if you haven't been there yet, because there's
Yes.
been a lot of changes, a lot of legislative changes. Thank you, Clay. And what about legacy, Jonathan? What are our most important lessons?
In the early months of COVID, I think we learned that our organization could be a lot more agile and efficient in decision making than we had previously known it to be. This learning came out of the evolution of what we refer to as our Emergency Operations Command Center structure, or EOC structure. During those first couple of months, starting in March, we opened up EOCs at all levels within the organization. So each of our hospitals had an EOC that was open. We had a system command center, and then we were also connected into a number of community-based command centers through county health departments, through the state. And that all linked us together in terms of quick communication and decision making. We talked about the drive-through testing. None of that existed before we went into COVID and had to be designed from scratch. We also had to design an entire system for how we screen employees, patients, and visitors on the way in to our hospitals. And what we learned through our EOCs and our focus on COVID was that we could make policy decisions in a matter of hours or days that oftentimes in the past, as we reflected on it, would have taken us probably months through our old bureaucracies. So as we came out of the first 3 months of COVID and started to wind down our EOC structure, we've been very intentional about evolving that into what we call our tiered huddle system. And today, and we didn't have this before COVID, today we have tiered huddles at 6 different levels in the organization. We call it T1 through T6. T1 is our frontline staff huddling at the bedside in their units. T6 is a huddle that Catherine Correa, our CEO, runs every single day at 11:30. And this has really allowed us to maintain that nimbleness that we had when we opened the EOCs. I thought I'd provide just one example that happened this week. Or happened a couple of weeks ago. We found that we were having a number of different injuries among our employees in terms of lifting of linen. So overfilled linen bins that were leading to lifting injuries for our employees. Through this structure, we were able to communicate about it and put into place what we call containment actions to make sure that couldn't happen to another person by the end of the day. And within weeks, we just started this week, we were able to line up for a pilot for brand new equipment and how we do our linen handling. So very rapid system to try to understand safety issues and put advancements in place to improve the situation. If we were to go back pre-COVID and look at how we used to meet and how we used to problem solve, it would have definitely taken us months to be able to get to sort of this pilot that we started this week around the linen equipment. Just as one example, I think on our daily action item list at the T5, we call it, that's where all the hospitals come together. We probably have 40 different things that we're actively working to make sure that we are advancing safety for our staff and for our patients.
Yeah, wow. And I have to say, I have seen a daily commitment to safety at Legacy since COVID has started in particular. That has been really wonderful and inspiring to see, and we see it every day. So thank you, Jonathan. What can the community do to support Legacy Health right now? What are our greatest needs?
I think at this time, really more than probably any other time that I can remember, we're really focused on helping families take care of their basic needs. We've been working closely with our social workers and helping families through what we refer to as our Patient Assistance Fund. And we have a lot of flexibility in what we do with those dollars. A few examples from the last year here, we've helped more than 2,000 patients with basic living needs such as rent, utility bills, bus tickets, meal vouchers, all sorts of different things that just really are critical for folks who are trying to get by. We provided more than 6,000 patients with prescription medications out of this fund. We provided free eye care and other types of care for nearly 900 patients. And we funded hotel vouchers for families with hospitalized loved ones. So really like to highlight the Patient Assistance Fund. It just can be used in so many ways that really meets families where they are with what they really need.
That's great, Jonathan. Over the past year or so, we've really taken the time to ask our patients and community, what is your greatest need and how can we help? And we were surprised to find that they consistently ranked food as their number one need, with housing second. So, yeah, that really surprised us. We didn't realize that food was so high of a need and so consistent. So, we got to work with our community partners and we created the Emergency Food Support Bag Program. Imagine you've just gotten discharged from the hospital, you feel terrible. The last thing you want to do is go shopping for healthy food, even if you can afford it at that moment. So these bags provide shelf-stable, protein-rich food to help our patients eat for a few days until they can access other food resources. And we do show them how to access those resources as part of the program too. It seems obvious, but studies show that when patients don't have healthy food, they have increased medical risks, damaged ability to heal, and it just causes a lot of suffering. So we don't want that. And I'm going to show you some nice photos of our amazing resource specialist, Amanda, putting together some food bags. And our most recent order served sites in Oregon and Washington and totaled 20 family bags, 21 individual bags, and 8 diabetic bags. So we are super excited to see the outcomes from this project and watch it grow. In closing, I want to thank you from the bottom of my heart, Jonathan and Clay, for sharing some important lessons from the past several months. Many thanks to you at home for everything that you're doing to support our community. We love you and we hope to see you soon.